Stay active, stay connected, stay wise and well. Call 410-662-4363 or learn more at chooskeswick.org.
Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Good evening. Welcome to a special edition of Direct Connection with highlights of recent programs. Just ahead tonight, advances in breast cancer treatment, but we begin with more cracks in the glass ceiling for women in politics. We spoke with Sarah Oliver, an assistant professor of political science at Towson University and author of Who Runs? The Masculine Advantage in Candidate Emergence.
It's a big moment. So obviously the vice presidency isn't quite the presidency. It's not quite what a lot of people were hoping for in 2016, but it's a huge step. There is something unique about the presidency, and being one heartbeat away is almost quite there. And it's just a wonderful moment for people who care about gender representation, about racial representation. She's a woman of color. She's got African American and South Indian descent. She's just a beacon of diversity that gives a lot of people a lot of hope.
When President Obama was elected 12 years ago, maybe some people were a little ahead of the curve in forecasting a post-racial America. Is it too soon to pronounce the end of any sexism in American politics?
Oh, it's far too soon for that. Just as the election of Barack Obama didn't change fundamentally the way that we see race in America, this isn't gonna fundamentally eliminate sexism or really have much effect one way or the other. We've seen in the last 4 years that having Donald Trump as the president has really brought more to the fore people who are willing to make overtly sexist and racist comments. And so I don't think that's going to be erased by someone new coming into the office. They might be quieter about it, at least for a while, but it definitely doesn't mean that sexism is gone by any means.
Help us understand your research in this a little bit. Let's unpack the title of the book, The Masculine Advantage in Candidate Emergence. What's that mean?
Yeah, it's talking about how men and women who are masculine in their personality traits, so things like assertiveness and toughness and decisiveness, lead people to be more likely to run for political office. So the people that fit this description feel more qualified and are more encouraged by others around them and are just more likely to end up as politicians and those who we see in Congress, and especially the presidency. The presidency is a place that has more masculine norms than any other office. And so in the context of Kamala Harris, it's important to see a woman, but in the context of masculinity, she really fits this model of a strong fighter, masculine personality that is more in line than many might think in terms of gender norms of the presidency.
Obvious double standard here. Women really have to thread a needle when it comes to the assertiveness you describe without running afoul of the S word, shrill, which has been applied to previous candidates.
Absolutely. So in gender presentation and in campaigning, there really is a thin line that many candidates have found a way to walk really successfully. Women have been running in larger numbers for the last 30 years, 40 years now. And so there is a playbook now for how women can run successfully. And so the next step forward is to get more women to run. It's really encouraging to see the number of women running for Congress and state legislative offices in the last 2 years, in 2018 and 2020. And I really hope to see that trend continue now that women at all levels have shown the ability to successfully mount a campaign.
The number of women in Congress, I mean, the trend has been very strong. The number I last saw was more than 100 women just in the House of Representatives. obviously a little bit less than a quarter of that body. Do you ever see a day when it's 50-50 or better?
Well, there's a long way to go for that. So every time we have an increase, it feels a little bit more like getting to parity. Back in 1992, the first election seen as the year of the woman, was seen as if we continue at this rate, they'll be at parity by, I don't remember what date it was, but there was really a plateau for a long time until this next jump. And so optimistically, I'd love to see this rate of increase continue. More realistically, it's going to be a while till we get anywhere near parity. Worldwide, even the legislatures with what's seen as really good representation of women often cap out somewhere between 30 and 40%. There's only a couple of legislators that have even come close to parity.
How about the importance of appearance for women? Not to say that it's not unimportant for men, because you think of the candidates for president, and both of them were making a variety of attempts to look more youthful. We'll put it that way. Women running for local office or high office, how do they have to think about that?
So role models are important. Seeing people who have done it before and who have created a playbook for you really make it easier for the next round of people to run. And so every time someone runs, and especially every time we have a successful year and a lot of new women of color, just general more diversity, it opens doors and opens the world of possibilities for many that may not have considered it before. I've seen it even in my students that have seen themselves as more potentially viable, more able to run for political office in seeing more people like them be successful.
How much is the pathway that you talk about, how much does it still involve law school, which was a traditional doorway into the political world? And we know that most of the students at American law schools now are women.
Right. So in our book on masculinity, that's one thing that we show, is that the more things change, sometimes the more things stay the same. So even as more women are running for office, as more people of color are running for office, we still see the same trends in the careers that lead to political office, the gender norms of political office. And so law school continues to be a great stepping stone to a political career, and that doesn't seem to be changing. For a little while, there seemed to be more anecdotes of people running for office from more areas of life, but lawyer, businessman, administrator, doctor occasionally are still the biggest fields that lead to political office, and that hasn't seemed to change much, even in recent.
How about Sarah, the pathway to other fields of endeavor and top leadership posts in corporate America and other places? How much is that similar or dissimilar to the political world?
There's a lot of similarities in terms of the pipeline, where we have more women graduating from college, women that are qualified for these higher executive positions, but we also see a similar trend in kind of a tapering towards the top. We have our first female vice president, even though we have lots of women in Congress. We've been over 20% of Congress for a while, but it hasn't gone to the presidency. We typically have more people in the state legislature than we do in Congress. And so there is some tapering off that happens as you go higher up the ladder. And the same thing happens in the corporate world, where there's more women filling the base of the corporate ladder than there are making it to the top.
How about the simple fact that kids growing up now will have seen people of color, women in the nation's highest offices, and that includes the Speaker of the House, when they're forming their mental images of role models, that's gonna feed into it.
Absolutely. Role models are incredibly important to political socialization. Who you see in office helps shape what you think that office is. And we see that who the president is can have big effects, positive and negative. We saw some really big effects from presidencies like Richard Nixon that threatened the public's trust in the presidency that have never quite recovered. We see some effects of Donald Trump being president that we wouldn't necessarily have expected just from having one kind of unique model. Barack Obama and his more collegial style seem to have some influence on what people expect from the presidency. And so seeing Joe Biden and Kamala Harris as our new leaders, I think will have an influence on what young people think of as normal for these offices.
A lot of pressure on the role model to succeed and continue to be that strong role model for the next generation.
Absolutely. There was actually some fear after 2016 that Hillary Clinton's loss would have a depressing effect on women. That it was like, well, she did well, but she still lost. So I guess no women can run anymore. And that doesn't seem to have happened. So what we've seen, especially in 2018, was exactly the opposite. Women were instead motivated and really wanted to get into the arena after seeing how well Hillary Clinton did. She won the popular vote. And so there is definitely the chance that even just having people there, having people even close to success can motivate the next generation.
Sarah Oliver's new book is Who Runs? The Masculine Advantage in Candidate Emergence. Professor, we do appreciate the time. Thank you.
Thank you so much.
And we'll be right back.
Can you tell us what you know?
Turning back now to the race for the White House.
The State Board of Elections voted Thursday to set up a new election.
It must be a very emotional day.
The world changed in the blink of an eye.
Children are at the heart of this story.
Dr. Aaron Rada, a plastic surgeon at the University of Maryland Medical Center and the University of Maryland St. Joseph Medical Center, joined us recently to talk about advances in surgical treatment of breast cancer. Dr. Rada is also an assistant professor of surgery at the University of Maryland School of Medicine.
I do breast cancer reconstruction after both mastectomy and partial mastectomy, or otherwise known as a lumpectomy. And there's quite a lot that has changed as surgical techniques have become more advanced, as the implants that we use to do breast reconstruction have become more advanced as well. We're able to offer women both more choices in terms of the type of reconstruction they get and the timing of that reconstruction.
Unfortunately, it's a disease that affects a lot of people, and I don't know how many wind up with surgery or what type of surgery, but what's the process after that in terms of the length of time before they might see you when they may initially be undergoing some sort of medical therapy as well?
Well, the great thing is that most women are able to at least start their breast reconstruction at the same time that they're getting their breast cancer surgery. So typically a woman will see a breast cancer surgeon who will meet with them and discuss their cancer, who will discuss different options for the cancer surgery itself, and then we'll refer them to see myself or another plastic surgeon. And I feel pretty lucky that I get to have this sort of silver lining conversation with women. And so before they ever get their cancer surgery, we usually have a plan for their reconstruction. We sort of go over all the options, and part of my job is really to educate women about what options there are. And we can often at least accomplish a significant portion of their reconstruction at the time of their mastectomy.
How often would you say it's a one-day thing?
Well, women who have a mastectomy can often get either a tissue expander or an implant placed at the time of mastectomy. Most frequently, it's not just a one-shot operation, but luckily the subsequent operations, sort of the little touch-ups, like I like to call them, are shorter operations. They're outpatient surgery, so not something that require that you stay in the hospital for. And they can be scheduled around a patient's life. It's not a cancer operation, so it can be scheduled when you have time off work or your kids are covered and that kind of thing.
Is it the sort of thing where it's never actually too late to do it? I mean, if somebody decides 6 months later, a year later?
Oh, absolutely. I tell women that all the time. The majority of women who are having breast cancer surgery and who see a plastic surgeon will elect to have some kind of breast reconstruction at the time of mastectomy, both in the United States and globally. But for women, occasionally I'll talk to a woman who's not interested in any type of breast cancer reconstruction. And I tell them, if at any point down the road you decide that you want reconstruction, it's never too late. You can always go and see a plastic surgeon and discuss options for reconstruction. And really, most options are still available to women, even if they choose to delay their reconstruction until later for whatever reason.
Obviously, this is a horrible diagnosis, a terrible time psychologically to go through for a woman and her family members. Psychologically, how does the reconstruction procedure fit into that?
It is a challenging time, and I'm frequently meeting patients, after they've gotten this diagnosis. And you're right, it's incredibly stressful for women and their families. And unfortunately, breast cancer is so common that most of us will know someone who gets breast cancer over the course of their life and will be at least somewhat affected by this disease. So not only do you have this diagnosis that you're contending with, but you also are having to process a lot of new information, both from your plastic surgeon, from your breast cancer surgeon, from whatever other members are involved in your care. So it's a challenging thing to just wrap your mind around, and you're forced to process a lot of information. It's really a lot at once. And I like to think of my role as helping people see sort of the light at the end of the tunnel, that, my goal is really to help women see past the cancer and focus on their goals for how they want to look, how they want to feel, and to restore that feeling of wholeness after dealing with breast cancer.
The implants, of course, historically have had some complications that people may associate with the materials involved. You indicated things are getting safer. Is that part of it?
Well, breast implants have had sort of a long history. The implants themselves have evolved over time, from first generation implants to the implants that we have today. And that's specifically referring to silicone or gel breast implants. In the past, the early silicone implants that were made, the silicone itself was pretty liquidy. So if you cut into a silicone implant, the silicone would sort of dribble out. The breast implants actually have one right here. Not sure if you can see this, but the breast implants that we have now, this is a silicone breast implant. The silicone inside this is more highly cohesive or bonded together. So if you were to cut into the side of this implant and squeeze it, the silicone would kind of squeeze out and then go back in. It would say stuck together. So that's one advance that's been made as far as the implants themselves go. But silicone breast implants really have been extensively researched for safety profiles. And there have been many scientific studies that have looked for correlation between silicone implants and various diseases. And there hasn't been a significant association between silicone implants and autoimmune disease, although it's still an ongoing area of study.
Aside from the timing of having this procedure, are there other choices that women have to make in terms of the exact nature of the reconstruction that you're going to do?
I like to tell women that in general, there are two main flavors of breast reconstruction. The first being implant-based breast reconstruction that we've sort of talked about. And I do just want to go back and mention that one thing that has been in the news lately that is associated with certain types of implants is something called ALCL. And I don't know if you'd like to chat about that more, but that's something that women should discuss
not
with
heard of it.
I'm sorry?
I know I've not heard of it, so please go ahead.
Breast implant, there's a rare cancer that women can get after they have had a specific type of breast implant, we think. It's referred to as BIA ALCL, and that's like a really long name that occurs after some breast implants are placed. It's actually not a breast cancer at all. It's a T-cell lymphoma. It stands for anaplastic large cell lymphoma, and it's actually a cancer of the immune system. It's very, very rare, but it's something that's been in the news recently, and there have been FDA hearings about it, and it's really an ongoing area of study. So we think that this is occurring in patients primarily who have what's called a textured implant, and that's where the shell or the surface of the implant is rough or textured. We don't think that it's as likely to be associated with smooth implants like the one that I just showed you where the surface of the implant is smooth, but that is something that's being studied actively. Just to follow up on the last question that we talked about. But like I was saying, in general, two main flavors of breast reconstruction. There's implant-based reconstruction and autologous reconstruction, which just means that you're taking tissue, skin, and fat from elsewhere in your own body, and that's being used to replace the breast tissue that's removed at the time of mastectomy. The other option that women have is if they're undergoing a lumpectomy or partial mastectomy where not all of the breast tissue is being removed, we can often assist with those patients as well, doing symmetry procedures to make sure that if you've had some breast tissue removed from just one side, that they look nice and symmetric after surgery.
And in situations where somebody is having a mastectomy, not because of a cancer diagnosis, but because of family history or genetic indications for that, is it possible there to do everything in one setting?
Typically, yes. The full spectrum of options are available to women who undergo those risk prevention mastectomies, what we call prophylactic mastectomies. So those are women who have a family history that puts them at high risk for developing cancer, but don't actually have any breast cancer at the time of surgery. So those women are candidates for implant reconstruction or autologous or your own tissue reconstruction. And often we can put in a breast implant immediately at the time of mastectomy.
And before we go, the importance of catching this condition early, doing the self-exams or medical exams, whatever it takes to catch it while it's most treatable.
Mm-hmm. Certainly, if any woman notices anything different or anything that has changed on self-breast exam, I would encourage them to go see their physician, whether it's a breast surgeon, primary care physician, their GYN physician, to be examined. And then screening mammograms are quite important. Screening mammogram age, the age at which you will start mammograms, depends on whether you're average risk or high risk for breast cancer. That largely depends on your family history. But you are certainly right that we have a much better chance of curing breast cancer the earlier it's caught. So it's kind of an intimidating process, particularly if you're doing it the first time, but well worth it.
Dr. Erin Rada with the University of Maryland Medical Center, University of Maryland St. Joseph Medical Center. Doctor, thank you very much.
Thank you so much.
Now a new exhibit at the Reginald Lewis Museum looks at last summer's turmoil and how it shaped a historic moment. Charles Robinson reports.
These signs, murals, they all tell the story across Maryland. The Eastern Shore, Southern Maryland, Baltimore City, they tell the story of why we protest.
The staff of the museum went looking for images, photographs, murals, paintings, and other items from the activists. They put them together in an exhibit called Make Good Trouble, Marching for Change.
You've asked a lot of young artists to participate in this process. Why bring them into this?
Well, because this is a story about now. So, of course, the Album Museum is about the past. We have 400 years of Maryland African American history. We're also about the future, but right now we're about the present. And in the present, this is a movement that's a part of our history that needed to be captured now.
One of those whose work is on display is Kyle Pompe, a photographer.
I just like to show the emotion, the raw emotion, and I like to show contrast. So like if I can find joy in the pain, I want to try to get the joy in the pain.
Single thing that was bringing them all together?
Yeah, just unity, like, you know, just humanity at this point. Like it was almost more of other cultures than it was of our culture down there, and it was a shock in a certain way, but it didn't seem like phony, you know, like it was really authentic, you know. Everybody just was out there for the same common cause, and it was amazing.
It's not unusual for the Reginald Lewis Museum to have exhibits like this. But this one seems a little personal.
When you see a picture of a child saying, "When do I change from cute to scary?" That's a message. When you say, "Make racism wrong again," that's a message. There are a number of lessons to be learned about where we are in our society on the issue of race.
The exhibit was inspired by Congressman John Lewis of Georgia. He would always say, never be afraid to make some noise and get in good trouble, necessary trouble.
Thanks for joining us for this special edition of Direct Connection. Updates on our future programs can be found online at mpt.org, and you can also follow us on Twitter and Facebook at MPT News. Now, for all of us at MPT, thank you for watching and have a good night.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.
Power outages are a thing of the past for Dogs Day Farm once they leveraged Maryland Energy Administration programs to install solar panels with battery backup. Learn more online at energy.maryland.gov.
What's your next move? Extend beyond your current position or make inroads into a new field through UMBC's professional master's programs and certificates in cybersecurity, data science, biotechnology, and more. Claim your future at UMBC.
MPT wishes to thank the following Legacy Society